Could a single dose of psilocybin cure depression? The science is shocking. Imagine this. You've struggled with depression for years. Nothing has worked. Therapy helps, but only a little. Antidepressants either don't work or they come with so many side effects that you can't stand them. Then one day you take a single dose of psilocybin, the active compound in magic mushrooms, and suddenly something shifts. You feel a deep emotional release, like a weight has been lifted. Within hours, your mind feels clearer, lighter, and free from the repetitive negative thoughts that have trapped you for so long. Sounds like science fiction, right? But this is exactly what scientists are finding in clinical trials. I'm Dr. Lucid, a digital avatar created to explain complex psychiatric topics in a way that's easy to understand. But behind me stands a real psychiatrist and psychotherapist with a subspecialization in geriatrics, bringing you cutting-edge research and expert insights into mental health. Today we'll take a deep dive into psilocybin therapy. We'll explore how it works in the brain, what the most recent studies reveal, and whether psychedelics are truly the future of depression treatment or just hype. In clinical trials, a single high dose of psilocybin has been shown to work faster than traditional antidepressants, and the effects can last for months. One study from Johns Hopkins found that 67% of patients who took psilocybin reported significant relief from depression symptoms for up to a year. That's something no SSRI can do. But before you rush to find magic mushrooms, let's break this down. How does psilocybin actually work in the brain? What do the most recent studies say? Is it safe? What are the risks? And most importantly, should you consider it? Stick around, because what you're about to hear might change everything you thought you knew about depression treatment. What happens in your brain when you take psilocybin? Let's get one thing straight. Psilocybin is not just another antidepressant. Traditional antidepressants like SSRIs work by gradually increasing serotonin levels over weeks or months. While they can be effective, they often come with side effects like weight gain, sexual dysfunction, emotional numbness, and a delayed onset of action. And even then, about 30-50% of patients don't respond to them at all. Psilocybin, on the other hand, works in a completely different way. Within minutes of ingestion, psilocybin is converted into psilocin, which binds to serotonin 5-HT2A receptors in the brain. This interaction leads to a cascade of effects: increased neuroplasticity, which means the brain's ability to form new connections and break free from rigid thought patterns; a dissolution of negative thought loops, which many patients describe as feeling a sense of clarity and emotional release; and a profound shift in consciousness, allowing individuals to process unresolved emotions and see their lives from a new perspective. In brain scans, scientists have observed that psilocybin temporarily disrupts the default mode network, the part of the brain responsible for self-reflection, rumination, and the constant negative thoughts often seen in depression. This may explain why people feel liberated from their depression after just one psilocybin session. Sounds promising, right? But does the science actually back this up? What do the most groundbreaking studies say about psilocybin? Let's dive into the hard scientific evidence, because hype is one thing, but actual clinical data is another. One of the most well-known studies comes from Johns Hopkins University, where participants with major depressive disorder received 2 high-dose sessions of psilocybin. The results were remarkable. 67% experienced a clinically significant reduction in depression symptoms, and for most, the effects lasted up to a year. Many participants described the experience as one of the most meaningful events of their lives, helping them break free from years of negative thinking. In another study published in the New England Journal of Medicine, 233 patients with treatment-resistant depression received either 1 mg, 10 mg, or 25 mg of psilocybin. The group that received the highest dose, 25 mg, experienced the most dramatic improvement, while the lower doses had less effect. Interestingly, the study found that psilocybin was particularly effective in patients who had failed to respond to multiple traditional antidepressants. At Imperial College London, researchers used MRI scans to observe how psilocybin affects the brain. They found that psilocybin increased connectivity between different brain regions, effectively breaking the rigid negative thought patterns that are common in depression. Participants reported feeling lighter, more open, and free from old emotional pain. These studies suggest that psilocybin has the potential to work faster and more effectively than conventional antidepressants, particularly for people who have not responded to other treatments. But what about safety? Are there risks involved? Is psilocybin safe? What are the risks? No treatment is perfect, and psilocybin is no exception. While it shows incredible promise, it's not without risks. The most common side effects reported in clinical trials include mild nausea, headaches, and temporary anxiety during the psychedelic experience. Some people describe feelings of intense fear or distress, often called a bad trip. However, in a controlled medical setting with trained professionals present, these experiences can often be managed and even transformed into valuable insights. It's important to note that psilocybin is not recommended for individuals with a personal or family history of schizophrenia or psychosis, as it can trigger hallucinations and worsen symptoms. Another important consideration is that psilocybin is still classified as a Schedule I drug in many countries, meaning it is considered illegal outside of approved clinical trials. Despite this, there have been no cases of serious long-term harm reported in any of the controlled studies conducted so far. How does a psilocybin therapy session work? Unlike traditional antidepressants, which are taken daily, psilocybin therapy usually involves 1 or 2 high-dose sessions. Here's how it works. Before taking psilocybin, patients undergo a preparation phase where they meet with a therapist to discuss their intentions, fears, and expectations. This helps build trust and emotional safety. On the day of the session, the patient lies down in a comfortable setting, often wearing an eye mask and listening to calming music. The experience is guided by a trained therapist who remains present to provide reassurance and support. After the session, there is an integration phase where the patient and therapist discuss the experience and how to apply any insights gained to daily life. The goal is not just a one-time breakthrough, but to create lasting positive changes in how the patient thinks and feels. Is psilocybin the future of depression treatment? So, will psilocybin replace traditional antidepressants? It's too early to say for sure, but the potential is undeniable. As more studies are conducted and more data is gathered, it's becoming increasingly clear that psilocybin could become a valuable tool in the fight against depression, especially for those who have not found relief with other treatments. Some places like Oregon have already decriminalized psilocybin therapy, and other states and countries may follow suit. Pharmaceutical companies are also developing synthetic versions of psilocybin, which could make the treatment more widely available and accessible. Experts predict that psilocybin could be approved for medical use within the next 5 to 10 years, but until then, it remains an experimental therapy. If you've struggled with depression and traditional treatments haven't worked, psilocybin could be a game changer, but it's crucial to use it only under professional supervision. Would you try psilocybin therapy if it became legal and widely available? And if you want to learn about other breakthrough treatments for depression like esketamine and ECT, make sure to check out my next video. Could a single dose of psilocybin cure depression? The science is shocking. Imagine this.